Alright guys, we have a patient here with pleurisy, pneumonitis, and infections associated with diseases.
What do you think it is?
Well, Hawks, it could be rheumatic fever or maybe even just an allergic reaction to some pollen.
I agree with Leslie that pleurisy indicates inflammation, but we need more information about the infections before we can make a solid diagnosis.
That's true, Randall. We should also consider if this is a bacterial infection, since that could cause the pneumonitis as well.
You guys are all wrong. It's a mycotic aneurysm. Those three symptoms add up to it.
Well, Hawks, we haven't ruled out the other possibilities yet.
And what makes you so sure it's not rheumatic fever or an allergy?
I agree with Randall. We should consider all potential diagnoses before jumping to conclusions.
I've seen this exact combination of symptoms before, and I'm telling you, we're looking at a mycotic aneurysm. Now stop arguing and just do what I say. We need to perform plasma ablation on the patient ASAP. It's risky, but it's the right treatment. You have no idea what you're talking about. I've been performing these surgeries for years, and I know exactly what I'm doing.
I understand that, Hawks. But if your patient has a mycotic aneurysm, plasma ablation is not the most effective treatment. We need to consult with other specialists before making any decisions.
You're questioning my expertise. Do you have any idea how many lives I've saved over the years?
I have a pretty good idea how many lives you've ruined over the years if we want to start from there.
Saved is the key word here, damn it.
I'm not so sure a life saved by needlessly throwing away a perfectly good prostate in the bin over the common cold was a life well saved.
He had stains on his sheets and in his underwear, Tracy. His wife hasn't thanked us yet, but I believe there will be a payday.
That is way too much information for you to know as his doctor, and too much information to freely share to your colleagues. Shut your goddamn mouth and get out of my office.
Son of a bitch. This was supposed to be a simple procedure. Why didn't you tell me it's mycotic aneurysm?
Randall, we discussed this with Hawks, and he said,
Oh, fuck Hawks. This hospital and every single person here.
none of them are my type. No thank you.
You have a type?
Yeah, I'm not into literally anyone who works or ends up here.
Hypothetically speaking, if you had a partner who had a life-threatening condition and they were directed here, you split up with them.
Yes,
Why?
been there, done that. When I'm not here, I pretend it doesn't exist. Try it sometime.
I do.
Pretend your life outside the hospital doesn't exist. Except better.
What's that supposed to mean?
Have a look at the fucking patient, maybe. They're still coding you, narcissist.
Oh, crap, they're dying.
The patient is dying. What the hell happened?
You probably got the diagnosis or treatment wrong.
That never happens.
It did this time.
It was an anomaly then, and probably your fault.
That's not what we're going to tell Tracy if you don't figure this out.
You three go to hell. I'm getting lunch. Well, I've been thinking about my case with Mr. Jones recently.
You don't want to talk about oncology?
Hell no. That stuff's depressing. Anyway, Mr. Jones may have cancer since my doctors said he's dying.
What are you planning to do about it?
Hopefully get him well enough so he becomes your problem. Gotta go. I'm sorry, but your concerns about my attire are irrelevant in the face of this patient's life-threatening condition.
We've heard your theories before, Hawks. You need to present evidence, not just assumptions.
I understand the skepticism, but I assure you Wolfram syndrome is our new diagnosis here. And yes, it's deadly serious. That's why we need to act quickly.
And how do you propose we treat this Wolfram syndrome?
With what? We don't have a treatment protocol for this disease, if indeed that is the correct diagnosis.
If Hawks is right about the diagnosis, then we're in uncharted territory. But we need to proceed cautiously.
The prognosis isn't good, but it's not hopeless either. We've got work to do. Let's get started. Well, look who's back.
It's my office. Where else would I be?
No, congratulations, Hawks. You found the right diagnosis for the patient.
Can you explain to me why the first thing you did after leaving the operating room was call up Chaplain John?
Because I thought he would have a better explanation to the patient as to why they had to die young, despite doing so many good things.
You're despicable.
So is John. Do you read the stupid billboards of hate he keeps promoting?
It isn't him doing it. It's the higher-ups funding this hospital. I hate it too.
No, you tolerate it because it earns you a good paycheck. You asked me recently what it means to sell out. This is what I meant. Don't talk to me ever again.